In this video, we're going to talk through the post-intervention angiogram accompanying the blog post. I'm also going to show you an older angiogram from the same patient from many years ago so we can see some of the vessels by comparison to how they looked prior to the acute event in this vessel. But let's start with the current day angiogram. So just using my normal colors here, the purple represents the RCA proper, and then those dotted white lines are the RV marginal branches. You can see that there's not really any branching here. We were expecting to see a PDA, but it's really slow flow in the body of the RCA. And if I let it play through a little bit further, you can see that actually the vessel cuts off sort of abruptly here. You don't see any branching. You don't see a PDA, you don't see a posterolateral branch, so you have to conclude that this is actually in the distal RCA. And in fact, there's a little bit of regional variation in contrast, and that tells you that there's probably a thrombus here. So there's denser thrombus here, so there's less contrast there. There's a little bit less thrombus here, so it's a little bit darker, and so on. And the other thing you see is that there's this little tiny branch vessel here at the proximal vessel, the proximal RCA rather, that has contrast hang up. This implies that there's thrombus in this vessel, and it's causing contrast to move through it really slowly. You can't really tell what this is. At first glance, I thought it was probably an RV marginal branch, but when I compared it to the old angiogram, I think it's more likely an atrial branch. But either way, you can tell that there's thrombus in the proximal vessel here. So I'll allow this to play through once more at slow speed so you can try to take in the entire angiogram. And then I'll show you the old angiogram for comparison. So this is an angiogram from many years ago, and I'll let it play through a little bit and show you my annotations. So here again, purple represents the RCA, white represents the RV marginal branches. This distal color here, the posterolateral branch, I've annotated in teal, and then the posterior descending artery I've put in this fern color. I kind of made up a new color here. This is that vessel we looked at in the prior angiogram that had contrast hang up. I think this is actually an atrial branch because you can see it seems to be going up here, not in the same direction as the RV marginal branches. Either way, I just wanted to point out how different it looked in the before. And notice that we actually didn't see this branch at all in the current day angiogram. So this must be completely occluded by thrombus and probably responsible for most of what we saw on the ECG with that large area of blood supply that's no longer going to the RV marginal. So keep that vessel in mind. I'll play this through one more time at slow motion to allow you to see the old angiogram, and then we'll look back at the modern day angiogram and you'll see that that big RV marginal branch is totally missing.